All right, diving in today, and wow, this is a heavy one. We're looking at cervical insufficiency. From what you sent over, it basically comes down to the cervix starting to open way too early, like second trimester early.
Yeah, scary stuff. And as you can imagine, that can lead to, well, losing the pregnancy before the baby's ready to be born.
Definitely not something anyone wants to go through. So let's break this down, shall we? What are we seeing in these sources about what might actually cause this to happen?
Well, it looks like there are a few different things that could be at play. Trauma to the cervix seems to be a big one, like from a previous difficult delivery or procedure.
Right, that makes sense. Damage like that could weaken things, I imagine.
Exactly. And sometimes it's not so much damage, but more about how the cervix developed in the first place, if that makes sense.
Okay, so like a congenital thing.
Yeah, and there's actually a really interesting connection here to DAGES exposure in utero.
DES, that rings a bell. Wasn't that a synthetic estrogen they used to give to pregnant women?
You got it. And it turns out that exposure to DES before birth has been linked to a higher chance of cervical insufficiency later in life.
Wow, that's wild to think about something that happened that early on having such a long-lasting impact. It's like a domino effect almost.
Totally. And there are other things that seem to increase the risk too, like certain connective tissue disorders. For example, the sources mention that cervical insufficiency is more common in people with Marfan syndrome and Ehlers-Danlos syndrome.
So those conditions affect like the structural integrity of the body.
Right. And the cervix is definitely part of that, so you can see how those conditions might play a role. But it's worth emphasizing that a lot of times, the exact cause of cervical insufficiency remains a mystery. We're still learning a lot in this area.
It's frustrating, isn't it? Like we know some of the risk factors, but not always the why behind it.
It is. But those risk factors are a good place to start when it comes to figuring out how to manage cervical insufficiency. And the sources actually talk about a few different approaches. Some involve lifestyle changes, things like bed rest, avoiding sex, and even taking a break from work or strenuous exercise.
Okay, yeah, those sound like pretty common sense recommendations, right? Take it easy and reduce any strain on the cervix.
Yeah, exactly. But here's the thing. There actually isn't super strong evidence that those things work for everyone.
Oh, interesting. So they might not be universally recommended then.
Not necessarily. It seems like they might be more beneficial in cases where an ultrasound shows that the cervix is already starting to shorten.
Got it. So more of a targeted approach makes sense. And I'm guessing for some people, lifestyle changes alone might not be enough. What other options are out there?
Well, that's where the surgical option comes in, and it's called a cervical cerclage. It's basically a procedure where they put a strong suture around the cervix to hold it closed.
Like a reinforcement almost.
Exactly. Think of it like a heavy-duty purse string.
Yeah.
And they can do this either through the vagina, what they call a transvaginal approach, or through the abdomen with a transabdominal approach.
So depending on the situation, they choose the best route. That's fascinating. Now, switching gears a bit, let's talk about what nurses are on the lookout for when it comes to cervical insufficiency. What are some red flags they should be aware of?
Well, like we've been saying, it's often a silent issue, meaning there might not be any obvious pain. So a really careful and thorough patient history is crucial.
Makes sense. The past might hold some clues. What kind of things specifically are we talking about?
They're looking for anything that could suggest a higher risk. So previous cervical trauma, like from a previous birth or procedure,
Yeah, we've touched on that. What else?
a history of preterm labor or second trimester miscarriages is huge.
So basically, if there's been trouble before, it's a warning sign.
Right. And this might seem obvious, but any past surgeries or procedures on the cervix, they'd want to know about that too.
Oh, and also a history of a loss around, say, 20 weeks would definitely raise some eyebrows.
So piecing together the patient's story can be super telling. And aside from that history, are there any symptoms that might signal a problem with the cervix?
Well, that's the tricky part. Cervical insufficiency often doesn't have the same, textbook symptoms you might see with other pregnancy complications, but the sources do mention a few things to watch for.
Okay, like what?
So they might notice an increase in vaginal discharge, and it could be tinged pink, or they might feel increased pressure down low in the pelvis. Some women also experience cramping along with vaginal bleeding.
Those sound pretty worrying.
They definitely are. And then perhaps the most alarming sign would be a loss of amniotic fluid. That's never a good sign.
No, definitely not. And from what I'm gathering, the scary part is that this can all happen without much pain initially. It's almost like a silent progression toward premature delivery. Exactly. And that brings us back to that quote from the material, the one that says, The cornerstone of diagnosis is a history of a pregnancy loss during the second or early third trimester associated with painless cervical dilation without evidence of uterine activity. I mean, that's a mouthful, but it really highlights how challenging this can be to diagnose.
It does. So let's say cervical insufficiency is suspected or diagnosed. What happens next? What are the nursing management strategies?
Well, first and foremost, it's all about closely monitoring for preterm labor. And that means being super vigilant, even if the patient isn't experiencing pain.
So nurses are essentially on high alert, looking for any sign that things are progressing too quickly. What specific things are they watching for?
Well, backache is one, even if it's mild. And any changes in vaginal discharge, like an increase in amount or change in color or consistency.
Got it. So anything out of the ordinary there.
Right. And of course, they're watching for rupture of membranes, meaning the amniotic sac breaking, and any signs of uterine contractions.
Right. Those are the classic signs of labor. And I imagine, along with the physical monitoring, there's a huge emotional component here.
Absolutely. Providing emotional support and education for both the patient and their family is crucial. They're dealing with so much uncertainty and anxiety about the well-being of the baby.
So nurses are really acting as advocates and educators throughout this process.
Yeah, exactly. If a cerclage is being considered, they'd provide preoperative care and teaching, making sure the patient understands what to expect. And importantly, they educate the patient on recognizing the signs of preterm labor so they can seek help immediately if anything happens.
That's so important, empowering the patient to be an active participant in their care. And beyond that initial education, are there other things nurses are doing to support the patient?
Well, they reinforce any activity restrictions the doctors recommended, making sure the patient understands why those restrictions are in place and how to follow them. And of course, regular follow-up appointments are key, so nurses would help with scheduling and coordinating that care. It's all about working together, to try to achieve the best possible outcome for the pregnancy.
Yeah, and it sounds like nurses play a really pivotal role in all of that, not just in terms of the medical management, but also the emotional support and education.
Absolutely. They're really on the front lines, using their assessment skills, their knowledge, and their communication skills to make a real difference for these families.
Okay, so taking a step back and looking at everything we've covered, what are the key takeaways here about cervical insufficiency?
Well, it's this often silent condition where the cervix starts to open too early during pregnancy, which can unfortunately lead to a loss before the baby's ready. And it's tricky, right? Because pinpointing the exact cause can be a real challenge.
It is. But as we've discussed, understanding those risk factors, knowing the potential signs and symptoms, and being proactive with monitoring and management, that's where we can make a real impact.
Right. And not to mention the importance of that emotional support and education. It's a team effort involving both healthcare providers and the patient to navigate this really difficult situation.
Well said. And I think this conversation leads to a really important question for everyone listening. Considering how hard it is to catch cervical insufficiency early on and the huge impact it can have, where do we go from here? What are the implications for research and for developing better, more effective early intervention strategies to support healthy pregnancies? It's something to think about.
Absolutely. There's always more to learn. And that's where hope lies, right?
Yeah.
In continuing to explore and improve the care we provide.
It does. And on that note, we'll wrap up for today. Thanks for joining us for this deep dive into cervical insufficiency. We hope you found it insightful and informative.
Thanks for having me.